Greetings, LICI. My name is Marie Kroma Sharif. I am the chair of LICI's Grant Committee. On behalf of the committee, I want to say thank you to all the participants who have agreed graciously to participate in our mental health series. This video is being funded by the Ohio Department of Mental Health and Drug Addiction Services. We appreciate their funding. The goal for this video is for the participants to tell us about their experience with COVID-19. Some of the participants experienced COVID. We know that COVID is very deadly. It has caused a lot of mental health problems. Our goal is for all of us to seek some information that will be helpful to us from what they're relating to us about COVID. We appreciate this, and we thank you so much for listening to the participants.
My name is Eddie, and I am a member of LICI.
Good afternoon. My name is Esther. I live here in Columbus, Ohio.
Well, my name is James Powell Kuna. I'm a resident of Canada, Winchester. What I know for the LICI is that it is the umbrella organization governing Liberians within Columbus, or Ohio, so to speak.
LICI is a community organization that has been making efforts to bring the community together through supporting the youth.
It is a very good organization. I would think they are unified. They are doing everything to make sure that Liberians within the length and breadth of this state cater for, legally and every other measures possible.
LICI is a Liberian organization that is involved bringing people together, supporting one another, and I really admire this community a lot. I've been here for about 3 years in Columbus, and I'm trying to get more involved with this community.
It's a very good organization that all Liberians here should try to identify themselves with because it makes you feel at home.
Sure, when I first realized I had COVID-19, I was very scared because the virus is a nightmare. And at the time, in 2020 of April, the virus had just started, so there was not much known about this virus, and it was really killing people. So me being a part of the first group that had the virus, it was really scary. You have family, you have friends that waited to help you. They can't come any closer because this virus is a very selfish virus that can kill somebody in no time. So people were willing to help. They will come and drop food at your doorsteps, and the support for the community was real.
Well, when I first realized I had COVID-19, I'm going to say it was scary because at the time in April 2020, there was really bad news coming from Italy and New York, and there was so much panic. So it was a really scary experience for me.
Well, that was very traumatic. The fact that the entire earth has come to a standstill, and everyone is afraid that the pattern of this entire, outbreak was very scary. So nobody wanted to be associated with anything that had to do with it, because the first thing that comes to mind is that I'm going to die, but it's different from the way people talked about it. It's different from the way I felt when I had it, because I was really normal. The only difference was, the loss of appetite. My smell sense was, absent, and then a little bit of fever started coming in and off and on. But those were the abnormalities. Nothing else about it. So except that when we were tested and said we were positive, and then I said, wow, then maybe the entire thing, the way people talked about it, it never reacted in me like that. So it's a disease that everybody wants to be afraid of. But I think you just need to be cautious. The aspect of fear should just be, completely just driven away because it's a deadly disease. But then the fact is, I was afraid to tell people because of people's reaction. You know, how would they see me? I'm a breadwinner. And if people start to, disassociate themselves from me, and then I had to stay away from job for a couple of times because I wanted my sincerity not to extend beyond the borders, like going to job because I had to win, everything for my family. But I was also not going to be fair to the people out there, like the other people at my job. I was going to be passing it on to them. So I took on myself without somebody telling me. I just informed my job that I needed to do self-quarantine and I had to stay home.
Well, I was excited to share that I had COVID-19 because I didn't go out of the body, and I felt like sharing my experience or telling people could save many lives or did save many lives because people had knowledge about it and you have to go about it.
Well, I think it was okay for people to see that their friend, their brother, or their colleague had the virus because I believe some people were kind of skeptical. So it was kind of like an eye opener, and it was a form of awareness for people to understand that this was really real, and it wasn't something that was just being fabricated on TV.
Personally, I didn't want people to know because the reaction was the fact that I was very afraid that people were going to resent me. People were not going to be willing to come around because the way the whole thing started, nobody wanted to be associated with even your own wife if you heard she had it. But then that's what I said. I didn't want for people to know that I had it. But again, I look at it from the other point around. A closed mouth is never fair. So the good thing about it was that if you learn to communicate it to people, there are other people who probably want your route. And they want you in their experience will serve as a help for you. So I kind of discussed it with my pastor, and then he gave me his experience too, because he went the same route. When I discussed it with my brother who's not there, brother Tano Cooper, and then so I kind of reached out to the closest people, but not just anybody who was not my family member. All right, so that my fear was their reaction. For these people, I knew they would not anyway resent me because they were family members. But beyond that, I didn't want for people to know that's my sincerity, and that was not the right approach too, but that was just me not wanting for people to, take over. I avoided people at that time, even the ones that I share with, I avoided them not because I was afraid of their reaction, but because I was desperate. I mean, I was the carrier. So loving these people would mean staying away from them, or else I would be passing it on to them. So I did it not because I was afraid of them, but because I was loving them, not to pass the disease on over to them.
Oh yes, I learned a lot of lessons. One is living a healthy life. If you can, just try a little best to live a healthy life. It helps a lot. If I wasn't doing a little bit of physical activity then, maybe it would have been very bad. It was bad. Who knows? I would have been here. By the grace of God, I am here. But I learned that we should live a healthy life, eat healthy as much as you can to support your immune system.
I learned that COVID COVID is a really serious virus because of the symptoms I had. Even though they weren't very severe, that was a lesson for me. Another thing was with I know of a member in the community that passed away from COVID, and I've spoken to people who had COVID and brushed it off and went home, and they had to be admitted in the ICU. So it's just I learned that COVID is a very strange virus.
What I would say to anybody, life is spiritual. And then if you want to keep living, always learn to share whatever that is not normal in you. Because sometimes you think the journey you want to go alone, there are other people who could be helpful to you. It's always good to share what you have. No matter how bad it is, tell people because the fact that you're telling someone, somebody is going to tell you, I was down that road before. This is how I walked it, and this is what I did. And because of their experience, it could help you even alleviate the particular situation that has caused the heavy burden of trauma on your mind. So sharing it is the best option, I would tell people. Don't keep it to yourself. You know, in the traditional saying, we Africans, we say, don't go to the hospital. That's what we said. And to be frank with you, I had that fear too. I didn't go to hospital for treatment. I just home treated myself. My wife and I, we did all of those crazy African things we would have done by the grace of God. The next time we tested, we were negative. All right, but that wouldn't be my recommendation because I'm not a medical person. Whatever necessary comes to the mind first is the approach you should take. But I would say don't keep it to yourself, share with other people.
I love my community and take care of yourself.
I just want to say to everyone that it's necessary to follow the CDC guidelines, especially if not for you, you could have it and be asymptomatic, but what about your colleagues? What about your family? What about you have older people in your family? One of my friends lost her uncle and her granddad, and it could happen to anyone. So this virus is real.
Well, I would just say Liberians, we are traditional people. Our upbringing has allowed us to do a lot of things contrary from medical principles, from some societal principles because of our upbringing. We came up, a lot of us were raised with the use of herbs or herbal treatment and stuff like that. Regardless of why it is, we are in an urbanized environment. First thing you want to do, always allow the medical medium to be the first when you are sick, because that's the best option. People who were trained, people who schooled to help you throughout the entire process are there and there for us. That's my advice to every librarian out there watching me or listening to me. Thank you.
Hi, my name is Connor Heckman, and I'm a board member of LICI. I've been a board member for a few years, and I have been in this community for many, many years. So I've been kind of a part of LICI for many years because I came in this country when I was 16 years old. And so one of the things that I've seen LICI involvement in the community has been to actually bring the community together, but also to make sure we are our brother's keeper. To educate our people on coming to America first, to also educate them about resources in the community. So that's one of the things that we are doing. But right now we are working to try to get our own community center, so that way we are not just an organization that's just social organization. We want to move it to a different level where we can be able to educate our people. We can be able to have daycare. We can be able to have different kind of community services that we can provide to our people. For example, if somebody comes from Liberia, how to navigate this community, how to navigate this country. We want to be in that place where we can be able to provide those information to them. We want a place where our children can go play basketball or whatever they need to do, even provide daycare to our community members. So these are things that we want to do because we just try to move the organization to a whole different new level that would be able to serve our community for the better. I think we can do a lot as a community by educating the people, like our churches. We have been using our churches to talk to the people because with COVID, people have been quarantined. They haven't been able to leave their houses. So we've been doing even the Zoom calls. We've been doing, been talking to the churches to talk to the people. We've been doing everything we can do to communicate this virus and how dangerous this virus is. So, for example, I'm a nurse. In my church, I try to communicate that this virus is very dangerous. And so at least I can be able to educate the people in my church. And I think other churches have been doing that to be able to get the word out that this is not something to mess around with. So one of the things we did as a community was to make sure that we did not gather in a place where there was a lot of people. So most of the churches kind of closed their doors down, and we kind of made sure we're doing most of our services online. So that we give our members the chance to be able to at least quarantine themselves or at least to be safe. So even the community, the LICI decided we will not have meetings where we have a lot of people there. We are not going to congregate anywhere that will have more than 50 people. So we took the precaution that we needed to take, And we made the decision as leaders to make sure that our people are not, putting themselves at risk, and we are not encouraging them to put themselves at risk. So the stigma was a lot of patients that I had, they were afraid to tell people that they had COVID because they did not want to be labeled as certain things. So in turn, they were able to put people's close to them lives at stake. So my advice to all of you guys, people that had COVID or people that have it now, is to be honest with yourself, to be honest with the people that you love. Because as much as you're trying to not be labeled as somebody with COVID, you are putting somebody else's life at stake. So be honest. And that's something that I saw a lot. And the reason is people told me, oh, because I don't want people knowing that I have COVID. I don't want people labeling me as somebody that had COVID. So I tried to hide it as much as I can. But at the end of the day, they still needed somebody to help them. So they had to open up to somebody. But in the meantime, if you have COVID and you are living with somebody, be honest with them. Because at the end of the day, you are putting that person and their family lives in danger. So my advice to all of us out here, we need to be honest with ourselves. And I know that we don't want to be labeled as this. I know that we don't want to be known as somebody that had COVID. However, you could save a life because it would be very bad or very detrimental to your mind or your soul or whatever if you know that you were a cause of the cause for somebody to lose their lives. So be very honest. Take the precaution. If you think that you live with people that you know that you have COVID, be honest with them. You guys sit down, talk about it, and try to figure out, okay, what precautions do we take to still be able to retain our, co-inhabitant here or being together and be able to save somebody's life or be able to protect them from getting COVID. So again, like I said, there was a lot of patients or people that I talked to or met that said that, hey, I had COVID, but I didn't want to share it with people because I did not want to be known as a person with COVID. So I tried to hide it as much. But in the same token, they were putting that person's life at stake. So let's be honest with ourselves. And I know nobody wants to be known as a COVID patient or had COVID, but it's reality. It is what it is, But that decision to share with somebody could save somebody's life. That decision to let other people know what is going on could save a whole family's life. So let's try to be honest with each other. Let's try to be honest with ourselves. If you think that you are sick and you can know because you know your own body, go get the test taken and start taking the precaution you need to take to be able to protect those that are around you. So like I said, I'm a nurse, I'm an LPN, and during the whole COVID-19, I have been working. So one of the things that I have been telling my patients is just a precaution because people would say, when this virus started, we didn't know so much about it. So all we could have done is try to educate our people and say, wear masks, wash your hands, social distance, stay away from people. But one of the lessons that I've learned, and at first, for me personally, I think it's just God. Because through all of this, my family didn't even get COVID-19. I'm not saying we took all the precautions. We tried to do the precaution. But I think the lessons that we have learned through this time that, hey, we have to listen to the rules, or we have to listen to our authority and try to follow those rules. Because sometimes we try to say, oh, well, they don't know what they're talking about, or I don't really need to social distance. But I think I have learned, even my patients, that they were able to listen to my advice. And so the lesson learned is we don't know everything about COVID, so we can only do those things that people have said we need to do, or authority have said we need to do. So by following that, a lot of us save a lot of lives. Because you might not know that you're saving somebody else's life. You might think, oh, I'm doing this just to save my life. But you're doing this, you're taking all those precautions to save other people's life. So that's the biggest lesson. But again, at the end of the day, COVID is still here. So we've got to continue, and I will tell you guys this, we've got to continue to follow those rules. Continue to social distance, we've got to continue to wear our masks, wash our hands, and those kind of things. And I think if we do that, if all of us do our part, we can make sure we eradicate COVID-19 as soon as possible so we can get back to our life, because I'm ready to get back to my life. again, I'm looking forward to COVID-19 kind of going away because there's a lot of things that have happened within this time frame that we just need to be able to just hang in there, can't give up. And the last thing I want to say too, because you do have your shots, your vaccine, I'm going to advise everybody, because you have your vaccine, does not mean you are a superwoman or superman. Does not mean you don't take those precautions. Does not mean that you just go and say, oh, because I'm like above everything now. No, you can still get it because now they do have different strains. And it's almost like taking a flu shot. Doesn't mean because you took the flu shot, you won't get the flu. You will get the flu because the flu has different strains. So my advice to all of us, make sure you are still taking your precaution. Does not mean because you have the shots, your first shot, your second shot, does not mean you are not immune to COVID-19. So my advice to all of us, let's continue to take all the precautions we can take to make sure COVID-19 is gone for real. All right? But thank you so much again for allowing me to speak to you guys. I appreciate it.
In conclusion, I would like to refer you to LICI's website. We have resources and information on programs we've done in the past so that you can use that to benefit you to understand COVID more. And if you have any questions, feel free to direct them to our president or the board of trustees or any member of the organization in an executive position. They'll be happy to answer your questions. Thank you and have a good day.